Hi, I hope that you, your family, and your loved ones are well. Michelle, Natalie, Ruth, and I, and the rest of the Orlando-based Sharing Smiles team have been missing you, and I know that you have been missing Sharing Smiles. We'd like to take this opportunity to let you know what we've been up to and what we're planning over the next 6 to 9 months. As you're aware, the worldwide COVID pandemic has had a huge effect on everything that we do at Sharing Smiles. At each of our sites, surgery is at a standstill. Clinic visits are at a standstill. As a result, we've had to cancel all of our trips for the remainder of 2020 and probably into the second quarter of 2021. As soon as it is safe for our patients, their families, and all of our volunteers and healthcare workers to resume these trips, we will do so. In the meantime, we've been working on 3 different projects. Number 1 is more of a long-range project. It's something we started a few years ago, and that is to create a patient database at each of our cleft sites that would include all the patients in their catchment area and what their medical needs would be, surgical needs, orthodontic needs. This tool would allow our local clinics to better plan for future needs over the next 3 to 5 years in coordination with the Ministry of Health. We're using this opportunity where our clinicians have some additional time to be able to jumpstart the rest of this database collection. The goal is to have it be electronic and shareable between sites, so we'll keep you updated on that. The second project that we're working on is that Michelle and Natalie are doing an analysis of each of our service lines at each of our sites and creating a list of things that we can do here in Orlando to help them get back into caring for patients. Some of these things might be need for personal protective equipment, they might be antibiotics, they might need sutures. So to the extent that we can participate in them getting back into the clinic and into the operating room, we would sort of do a virtual trip without our volunteers, but with sort of back office support. And then the third thing that we're working on is updating our policies and procedures for how we run some of our trips. With the COVID pandemic out there, we'll need to rethink safety of our patients and their families and each and every one of our volunteers, both medical and non-medical, that might come in contact with patients. We're very fortunate that we have many volunteers in the Orlando area with a lot of expertise in this, and we have already begun looking at ways that we can make these trips safer. So we can't do any of this without all of the wonderful volunteers that we have, like yourself. We ask that you will continue to stay connected with us and that you will continue to help us share a smile. Again, thank you for everything that you do, and we look forward to seeing you on the next trip.